A major announcement today in the fight against COVID-19. The Johnson & Johnson COVID vaccine is now on a recommended pause as health officials work to learn more about a rare blood clotting side effect.
This pause comes as nearly a quarter of Ohio's population is completely vaccinated. Right now, the Department of Health says almost 1,300 people are in the hospital for the virus. More than 2,300 new cases of COVID-19 are being reported today throughout the state. Tonight, thousands of doses of the Johnson & Johnson vaccine here in Central Ohio, they are sitting in storage. 6
women have reported blood clot issues after getting the shot all across the country. There have been more, though, than 7 million people who received the one-dose shot. NBC4's Eric Halperin tells us how many doses are sitting in storage tonight.
We are instructing providers who have Johnson & Johnson vaccine to store those, hold on to those until they receive further guidance.
Thousands of doses of the Johnson & Johnson vaccine now on refrigerator shelves right here in Central Ohio. About 7,000 of those doses are with Columbus Public Health. Health Commissioner Dr. Mashika Roberts says they're good through May and June.
And so as long as we get the go-ahead in the next few weeks, we can still use what we have in storage right now.
Doctors point out because it only needs regular refrigeration, J&J is the easiest of the vaccines to store. A spokesperson for the Wexner Medical Center says it's holding about 3,200 doses.
It should not be a problem for the amount of doses that we have in the storage that we have in place.
And according to a Mount Carmel spokesperson, the hospital system has about 280 Johnson & Johnson doses. Cedarville University professor of pharmacy practice Dr. Zach Jenkins says storage won't be a problem for big providers, but could be challenging for some smaller ones.
I think probably the biggest issue that some of those places may run into is, do they have the shelf space? Can they maintain the shelf space to store the vaccine for that period of time?
He says he's disappointed pause is pushed on J&J, but understands why it's happening.
So it can definitely cause waves that we don't anticipate heading in the wrong direction. But then on the other side of things, it's really important that we do dig deeply into these things to make sure these are very safe.
That was Eric Halperin reporting. The head of the FDA says she expects the pause will be in effect for a matter of days. J&J's website says the vaccine lasts for 3 months if stored properly.